In the fall of 2008, Barack Obama said, on healthcare reform, the American people are too often offered two extremes. Government-run healthcare with higher taxes or letting the insurance companies operate without rules. I believe both of these extremes are wrong. The following week, Barack Obama won the presidential election. Having the ability and means to obtain adequate health care has always been a struggle in our country. Many people can't afford it, and even those who could still have trouble paying for their prescriptions and other needs. Obama realized this and decided to make a change. The idea of the Affordable Care Act was first brought about when Barack Obama was ashamed of how the government was handling health care. In March 2009, Obama called for a health summit. The attendees of the summit were doctors, insurers, drug companies, consumer advocates, and lawmakers. Obama appointed Kansas Governor Kathleen Sebelius to run the Health and Human Services Agency, along with being the head of White House Office for Human Reform. In July 2009, the Democrats introduced a 1,000-page plan to overhaul the healthcare system, which the Republicans wanted no part of. The House of Representatives okayed the Senate's version of the healthcare plan on March 21, 2010. The final vote was 219 to 212, and all the Republicans voted against it. The Affordable Care Act was passed on March 23, 2010, but it took some time for all parts of it to take effect. Under this act, legal residents are required to obtain insurance, and those who don't will be required to pay a penalty. The penalty is currently $95 a year and will be $695 a year in 2016, and half those amounts for their children. According to the Congressional Budget Office, about 30 million non-elderly residents will be uninsured in 2016, but that the majority of them will be exempt from that penalty. There are some people that are oppressed individuals that can't even afford to pay for health insurance who are not exempt and forced to pay the high penalties. Examples of those who are likely to be exempt are people incarcerated or members of Indian tribes, unauthorized immigrants, people who have income below 138% of the federal poverty guidelines. Some of the major effects of the Affordable Care Act took place on January 1, 2014. One of them was children could stay on their parents' insurance until their 26th birthday, which plans before would remove them at age 19. This gives children an opportunity to be covered until they could secure a job of their own that provides benefits. The number of children uninsured in the 19 to 26-year-old age range dropped 13% within a year of the limit being increased compared to those numbers in 2010. Since the Affordable Care Act took full effect in 2014, the results have shown to be mostly positive throughout the country. According to the New York Times in October 2014, the number of Americans without health insurance has dropped by about 25% this year, or 8 million to 10 million people. Majority of those who have signed up have qualified for subsidies. 85% have received federal subsidies to help pay premiums, and costs was lowered by 76% on average. People were starting to take advantage of the new healthcare system and getting medical attention because they knew they weren't going to be taken advantage of and would get more for their money. Insurance companies were required to cover anyone with a pre-existing condition. There were no longer annual or lifetime dollar limits, and insurance companies can no longer impose unjustified rate hikes. Although many are benefiting, there are still millions that can't afford health care, even with all the actions being done by the government to reduce the costs. This is mainly the working poor who can't afford health coverage and are delaying seeking medical treatment to save money. In conclusion, health insurance has always been a struggle in this country. Ever since Barack Obama introduced the idea of the Affordable Care Act, it captured and excited a lot of citizens. Although it took some time to get passed, so far the outcome has been mostly positive for our country. There are still those who can't afford health care, but the number of uninsured has dramatically decreased.